Do you know which cancer has the highest number of patients today? That cancer is colorectal cancer. In terms of mortality, it ranks number 1 among women and number 3 among men, making it a serious cancer no one can ignore. Some experts suggest that the westernization of American diets may be contributing to the rise in colorectal cancer. And the symptoms rarely appear in the early stages. And when suspicious symptoms appear, a medical consultation is necessary. The earlier it is detected, the higher the chances of successful treatment. More importantly, even before symptoms appear, there are scientifically proven methods for prevention and early detection that everyone should know. And there is also important knowledge you should know about polyps. So, what symptoms of colorectal cancer must never be ignored? And what are the prevention methods you should absolutely know? Welcome back to the Well-Aging Research channel. Today, let's learn another important health topic together. Today's topic is colorectal cancer. Among all cancers, colorectal cancer is currently increasing and ranks first in incidence, making it something everyone should pay serious attention to. Even among public figures, people like Chadwick Boseman brought major attention to the severity of colorectal cancer. But early detection can significantly reduce the mortality rate. In this video, we will explain in detail the symptoms of colorectal cancer and the risks associated with polyps. At the end of the video, we will summarize preventive methods as well, so please watch until the end. So, let's get started. First, let me briefly explain what colorectal cancer is. First, the large intestine is a passageway for food. It is the organ located after the stomach and small intestine. It consists of the ascending colon, transverse colon, and descending colon. Then stool passes through the sigmoid colon and rectum and is finally discharged from the body through the anus. When cancer develops in any part of the structure, it is called colorectal cancer. The small intestine before the colon mainly absorbs nutrients and water. It absorbs nutrients and water from the digested food. On the other hand, the primary role of the colon is to form stool and serve as its pathway. From the leftover waste after nutrients are absorbed in the small intestine, the colon absorbs any remaining water and nutrients and finally forms properly shaped stool to eliminate it from the body. If the colon does not absorb enough water, diarrhea may occur, and conversely, if the intestines are sluggish and stool does not move smoothly, the stool becomes harder over time and constipation occurs. And when it comes to where colorectal cancer develops, colorectal cancer is far more common than cancer in the small intestine. The reason is not fully understood, but unlike the small intestine where food stays briefly, one theory suggests that stool remains longer in the colon, creating more irritation. Statistically, about 70% of colorectal cancers occur near the anus, particularly in the sigmoid colon and rectum. Again, the exact cause is unclear, but it may be because stool tends to remain there longer and is more solidified, causing increased irritation in those areas. So how are tests and treatments actually performed when cancer develops in the colon? First, many people ask, can colorectal cancer be detected through a blood test? A blood test alone cannot confirm it. It is true that blood tests can measure tumor markers, proteins that tend to increase when cancer exists. Colorectal cancer also has markers such as CEA. However, these results are only reference indicators and cannot be used as definitive diagnostic evidence. The most useful method for diagnosing colorectal cancer is a lower gastrointestinal endoscopy, commonly known as a colonoscopy. Those who have had one likely already know you first drink a laxative to empty the bowels, and then a camera is inserted through the anus to check for tumors from the inside. If a suspicious area is found, tissue is taken to determine whether it is benign or malignant. Many of you have likely heard the phrase, a polyp was found during the colonoscopy. You may also see it often in health checkup programs on television. So how should we interpret the presence of a polyp? In fact, polyps can be either benign or malignant. If it is benign and under about 5 millimeters, doctors may simply monitor it. But if it is larger, it is often removed immediately. However, if it is an adenomatous polyp, considered precancerous, it is sometimes referred to as a precancerous lesion. In such cases, removing it quickly is believed to help prevent colorectal cancer. The ability to detect malignant polyps early is one reason colonoscopy is such an important test. Removing it is often considered helpful in preventing colorectal cancer. For this reason, colonoscopy is valuable as it allows early detection of malignant polyps. One important thing to remember is that removing a polyp does not mean the issue is fully resolved. This fact is extremely important. The reason adenomatous polyps occur is often due to a body constitution that is more prone to developing colorectal cancer. So removing them does not mean the problem is solved. It should be seen as a signal from the body saying, you're at risk for colorectal cancer, so be careful. Please understand it this way. Regarding treatment, if colorectal cancer remains in the superficial layers, you are very fortunate. In such cases, it may be possible to remove the tumor and surrounding tissue using a colonoscopy. However, if the tumor has invaded the muscular layers or if there is lymph node metastasis, then surgery under general anesthesia may be required. This may sometimes involve open abdominal surgery, but if possible, laparoscopic surgery is performed using small incisions and a camera. This results in minimal scarring. After surgery, the anus can sometimes be preserved and remain usable. But in other cases, an artificial opening must be created for waste elimination. If there is suspicion of metastasis throughout the body, radiation therapy or medication-based treatments may be necessary. Therefore, detecting colorectal cancer at the earliest possible stage allows for treatment options that are less invasive and more effective, which makes early discovery critical. In medical terms, these are called neovascular vessels. The blood vessels originally formed in the human body are strong and well-constructed, but cancer cells are like amateurs at building blood vessels, so neovascular vessels are fragile and poorly constructed. And when stool passes through the colon and hits these fragile vessels, the vessels rupture easily, causing bleeding. As I explained in the stomach cancer video, when bleeding occurs in the stomach, it takes time to travel through the intestines and reacts with stomach acid, resulting in dark-colored stool. On the other hand, because the colon is located close to the anus, bleeding from colorectal cancer leaves the body while still fresh, appearing bright red. This is medically called hematochezia, meaning bright red blood in stool. Of course, hemorrhoids or anal fissures can also cause blood in the stool, but if bleeding continues for a period of time without a known cause, colorectal bleeding must be considered as a serious possibility. Another symptom of colorectal cancer may include sudden dizziness or lightheadedness. This occurs because colorectal cancer may lead to anemia. As explained earlier, bleeding from fragile cancer-formed vessels causes blood in the stool, and repeated bleeding gradually reduces blood volume in the body, leading to anemia. This can cause various anemia-related symptoms. A key indicator of anemia is hemoglobin, which generally should be above 7G/DL. However, some patients visit the hospital with hemoglobin levels as low as 4, requiring emergency blood transfusion. These kinds of cases do occur. This symptom is not exclusive to colorectal cancer. However, rapid weight loss can occur as a symptom of cancer. Of course, if weight loss is intentional, due to dieting or reduced food intake, that is not concerning. But if weight loss occurs without any intentional effort, it is suspicious and concerning. When cancer cells begin to proliferate inside the body, they seek nutrients from the human body to survive. To obtain those nutrients, they break down the host's protein and fat, using them as fuel, resulting in weight loss. Specifically, if more than 5% of body weight is lost within 6 to 12 months, it is medically considered abnormal. Please keep this in mind. As colorectal cancer grows larger, it gradually narrows the passageway for stool, which may result in thin stools or constipation. And if constipation is caused by colorectal cancer, eventually the tumor becomes large enough that stool can no longer pass. The tumor blocks the passage completely and waste accumulates. This may lead to severe abdominal pain. This condition is medically called bowel obstruction. In severe cases, prolonged constipation due to colorectal cancer may lead to sudden abdominal pain and emergency surgery. Of course, thin stools are common, especially in women, so worrying too much is unnecessary. But if constipation lasts too long or is accompanied by pain or occurs alongside other symptoms, it is recommended to consult a doctor. As explained earlier, one of the symptoms of colorectal cancer is blood in the stool. Visible bleeding can be detected easily during bathroom use, but not all bleeding is visible to the naked eye. Sometimes only a trace amount is present, and it may be invisible to the human eye. The FBT can detect such invisible blood traces. The procedure is very simple. You simply collect a stool sample and submit it. The lab then tests whether blood is present. To reduce false negatives, the test is typically done across 2 separate stool samples. If the result is positive, a follow-up colonoscopy is strongly recommended. Studies have shown that FBT can reduce colorectal cancer mortality by up to 20%. The U.S. Preventive Services Task Force, USPSTF, gives this test a Grade A recommendation for individuals aged 50 and above. It is rare for cancer screenings to earn a Grade A rating, which is why this screening is highly recommended. Unfortunately, however, according to a national health survey conducted in 2016 in the United States, the participation rate for stool blood screening was only around 40%, meaning nearly 60% of the population is not being tested. What about you? Since not all cancers have proven effective screening tools, this test offers exceptional cost-effectiveness. So if you're over 50 and haven't taken it yet, you absolutely should. A commonly asked question is, how often should I get a colonoscopy? The answer depends on individual health conditions and personal risk factors, but generally, the U.S. Preventive Services Task Force recommends 2 colonoscopies within 10 years. In other words, most people do not need a yearly colonoscopy. So for colorectal cancer screening, take the fecal occult blood test annually and only undergo a colonoscopy if the result is positive, and even if the test is negative, you should still have at least 1 colonoscopy every 10 years. Even if you dislike the procedure, please try. Once every 10 years is important. Now, let's move on to one of the most important topics, how to prevent colorectal cancer. Early detection is important, but colorectal cancer is also a type of cancer that can be greatly prevented through simple daily lifestyle habits. So let me walk you through practical prevention methods that anyone can start applying today. First, let's talk about diet. Research shows that excessive consumption of red meat, such as beef or pork, increases the risk of colorectal cancer. Processed meats such as ham, sausages, and bacon are classified by the WHO as Group 1 carcinogens. So rather than eating red meat daily, it is recommended to limit it to once or twice a week. So what should you eat instead? Poultry, fish, tofu, beans, and plant-based protein sources are much healthier alternatives. Another important factor is dietary fiber. Fiber from vegetables, fruits, brown rice, and whole grains helps prevent waste buildup and supports a healthier gut environment. Aim for 20 to 30 grams of dietary fiber per day if possible. Fermented foods such as kimchi, miso, yogurt, and natto can help increase beneficial gut bacteria. A balanced gut microbiome supports overall colon health. Next, let's talk about exercise. Regular physical activity is one of the most effective ways to reduce colorectal cancer risk. It doesn't have to be intense or complicated. Brisk walking, cycling, or light strength training, anything sustainable is enough. The general guideline is 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week. Weight management is also crucial. Abdominal obesity, especially visceral fat, significantly increases colorectal cancer risk. So it's important to monitor both weight and waist circumference. Smoking and alcohol also require attention. Smoking increases not only colorectal cancer risk, but also the likelihood of developing polyps. Excessive alcohol repeatedly irritates the colon lining and raises cancer risk. If you drink alcohol, try reducing how much and how often you consume it. Finally, the most reliable prevention method is regular screening. If you are over 50, having a fecal occult blood test every year is highly recommended. And having at least 1 colonoscopy every 10 years is one of the best ways to prevent colorectal cancer. If you have a family history or have had polyps removed before, you may need to begin screening earlier. Colorectal cancer progresses quietly, but it is highly preventable. If you put these habits into practice, they will make a meaningful difference in protecting your colon health. Now let's also talk about how to prevent colorectal cancer in daily life. This applies not only to colorectal cancer, but to cancer in general. Behaviors that increase colorectal cancer risk include smoking, excessive alcohol, lack of exercise, and obesity. It is important to exercise regularly and improve unhealthy habits. And in terms of diet, data shows that for every increase of 65 grams of red meat consumed per day, colorectal cancer risk increases. Of course, it may be difficult for many people to avoid red meat entirely, so if you eat too much, try reducing the frequency, and because there is currently no data linking poultry to increased colorectal cancer risk, replacing some red meat with poultry may be a healthier option. The key points for early detection and prevention of colorectal cancer are, if unexplained bleeding or bleeding with constipation continues, do not ignore it. For early detection, individuals over 50 should take the FBT every year, and have at least 1 colonoscopy every 10 years. Prevention ultimately requires healthy lifestyle habits and exercise. The simplest, basic actions are the most effective. If you eat excessive red meat, reduce intake or replace it with poultry. Please remember these 3 essential points from today. This knowledge may one day help protect your life. Watching our other cancer-related videos will also deepen your understanding. Whether you like or dislike the video, your feedback is valuable and helps improve future content. This has been Dr. Misa Lee from the Well Aging Laboratory. Thank you, and I'll see you again in the next video.